Hello, my name is David Wu, and I'm a junior at Korean Lutheran High School. For the past 2 years, the coronavirus pandemic has dominated the lives of every person on Earth. In the United States alone, nearly 870,000 lives were lost since January 2020, and the death toll continues to mount to this day. With millions of deaths directly caused by the virus, it is easy to overlook those resulting from drug overdose and suicides, triggered by the mental stresses of the pandemic. The Well-Being Trust and Robert Graham Center predicted that nearly 75,000 additional people would die from suicide and drug abuse caused by the COVID-19 pandemic. There were severe factors that led to the increase in suicide, an increase in depression rate, unemployment rate, and drug abuse. The first factor leading to suicide is depression. This graph shows the comparison between responses from before and during the COVID pandemic. It showed that 27.8% of respondents demonstrated symptoms of depression, which is a threefold increase from 2018. COVID-19 has led to a significant increase in psychological harm, contributing to a higher rate of suicide regardless of age, race, and gender. The next factor is unemployment. Lockdowns threaten the lives of people from lower socioeconomic backgrounds, leading to more extreme problems. The pandemic heightened the socioeconomic inequalities that led to depression and suicide crisis. According to Franston Woodbury, between March and June of 2020, nearly 49 million Americans filed for unemployment benefits, which contributed to stress symptoms of losing jobs, as the graph depicts. Finally, the increase in drug use is also concerning because the pandemic restrictions constrain the risk mitigation process. As you can see in the figure, a recent study revealed that close to 1/3 of US respondents who use alcohol or other drugs reported an increase in usage during the pandemic. Studies suggest that substance abusers are 6 times more likely to commit suicide, and nearly 90% of suicide victims have one or more psychiatric disorders. It is clear that not enough was done to treat loneliness and mental illness caused by the pandemic, and these mental problems, if left unattended, will have far-reaching negative consequences for the society. I believe that telehealth is one of the most effective tools to solve this problem. Access to telehealth medicine greatly improved during the pandemic, about 63-fold according to a recent study by the Department of Health and Human Services. This statistics is promising. Telehealth proved to be useful because of its remote nature, meaning that there was no risk of COVID transmission. And with modern biometric technology, such as smartwatches, doctors and psychiatrists were able to more effectively give more holistic medical advice on patients' remote schedules. In order to effectively combat rising depression, it is imperative that telehealth becomes more accessible. Americans are more willing than ever, with nearly 3/4 of surveyed Americans stating that they are open to virtual care. Improving mental health care access will allow more people to get the treatments they need. Easier access to care can help reduce the significant emotional and psychological impact of living throughout a pandemic. The pandemic has been extremely emotional and psychologically taxing for all those who have lived through it. However, through social distancing and other regulations, we together have almost gone through it as a community. I'm hoping to see the end of the pandemic soon. Thank you very much for watching my video.